hard to have a blanket statement about this, right? But when it comes to planning for absolute end of life, and you have various illnesses or advanced age, the stuff we normally do in medicine for younger people does not work the same as the body ages, let alone if you have progressed in Alzheimer's dementia to the end stages, right? Especially that end stage Alzheimer's where the person needs total care, bedbound, probably frail. Cannot change that, cannot reverse it, cannot improve function. And then end of life happens, the heart stops. Doing CPR, life support, all those things that are the standard of care does not work well. The outcome of survival for a person who lives in a nursing home who gets CPR is 0% survival. It works to get people back, but then we can't fix it. And what happens after that? And it leads to really difficult decisions for whoever's going to be speaking for that patient. So the best way to navigate this based on your personal beliefs and the medical facts is to say what you want. So the state of Texas gives you 3 tools to navigate this, and they're free. You don't need an attorney for this. And usually you get these copies of these forms from your primary care physician. All hospitals are required by law to provide people with access to these documents if you're ever admitted to the hospital, or even if you go there for a outpatient procedure. They're required by law to provide you with access to it. Usually video will plan for it, but you can just ask about it. The first document is called a medical power of attorney, right? Absolutely everybody should have one of these, and there's no excuse not to. Absolutely. It doesn't obligate them financially. It doesn't have anything to do with power of attorney for bank accounts or finances. It's about the patient selecting the person who will speak for them if they cannot speak for themselves. Only in that situation. The person is incapacitated, they cannot make medical decisions, they designate, this is the person I trust, who I feel is capable of expressing their wishes. And I've talked to that person about my wishes, how I view this. And that person will speak to the doctors for me, medical power of attorney. Absolutely must have. No excuse not to have it. If you don't have one, the state will appoint one for you. For better or worse, it's your spouse. Right? If that sounds like a good idea, you're pretty okay. If it sounds like not a great idea, you need to do that medical power of attorney. Okay? If you don't have a spouse, it's a majority of the rules of your adult children who are available. That may be a good thing, maybe a bad thing. Notice the majority rules. So if you have 2, it could pose a big fight. If you got 3, somebody's going to be on the outs potentially. If you got 10, which is very common in the valley, it turns into a jury. Okay. Barring that, it's your parents. And then it goes to the worst of all, your siblings. If it falls to siblings, it's a unanimous decision of your siblings. I discourage that to no end. There's always going to be one sibling that argues for both. The medical power of attorney avoids that situation. And the whole point I'm saying it, like I'm saying it, a little bit jovial, but that person can end up getting, the patient could get real hurt by those family dynamics, by the emotions involved, right? So it's using just one simple document can avoid a lot of trouble. The next part of this plan is something called an advance directive. So an advance directive, again, their name for it is living will. It only applies in a few situations. Number 1, you can't talk, or you don't have capacity to make decisions. That's the only time you look at that document. If you can talk, we'll talk to you. And one of 2 conditions is met. And here's the quote from the law. Because Texas has something called the Texas Advanced Directives Act that is specific on how this works in the state of Texas. If you're from out of state, you should definitely repeat this one for Texas, because Texas is very specific. If in the opinion of your attending physician, you have either a terminal condition or an irreversible condition, how do you want to be treated? Right, so terminal condition means that the doctor says no matter what we do, you have less than 6 months to live. Irreversible condition is we can do a lot to keep you alive longer than 6 months, but we don't ever expect you to get better. This is now permanent. Think about permanent brain damage. Think about progressive dementia, like Alzheimer's. That's an irreversible condition. It's going to progress, it's not going to get better. If the person is now incapacitated, how do they want to get treated? Because we do have medical technology to prolong life in Alzheimer's dementia. But what we can't do is reverse it. Our best treatments, our most modern treatments, delay it. Can put it on pause maybe rewind it a bit. But it doesn't change it or cure it. So it's an irreversible condition, and it's chronic and progressive. If that happens, how do you want to treat it? And then basically Texas gives you option A and option B. Option A is, let me go and die naturally and peacefully and make you comfortable. I want care to make you comfortable. Or, I don't care what you think, doctor. I want you to use all medical technology to prolong my life. Even if you wouldn't do that, I don't care, I want it. It can be either one. Okay, it depends on what the patient wants. 90% of people would select allow me to die peacefully and comfortably. 10% of people pick the other option. What matters, what's right or wrong, is what the person wants. And then the same thing goes for irreversible conditions. You gotta watch out for me because I can talk for a long time. So we have a medical cognitive training, advanced directive, and then the other one, the other document, and this is the only one that actually needs to be signed by a physician in the state of Texas, is called a do not resuscitate. So if a person has reached an advanced stage of illness, or they have an irreversible, and they say, I know I'm mortal, one day my heart will stop. And when it does, doctor, I do not want you to restart my heart. And if my lungs fail, I do not want you to put me on a breathing machine. Because based on my understanding of my illness, chances of it working, bringing you back to good health, quality of life that I will find are very low. And the chances of bringing you back and suffering, dying, are really high. So I do not want that. So in Texas, not have some car, you actually need a doctor's. Not have some. You can say whatever you want, it doesn't matter. Once you're involved in healthcare, once you're in the ER, and 911 ambulance, either your medical power of attorney or family needs to stop us, right? Or you need to have this document. Otherwise, we're obligated to do it, no matter if you look at the patient and say, this is a bad idea. It's the only time the state does not allow the doctors to do medical job. The only treatment I ever have to provide, I know full well it's bad for you. It's because we give you life and death in Texas is a very absolute. Legally in Texas, the worst thing that can happen to human beings is that they die. So the law is designed to try to avoid that at all costs, unless the person says, hey, listen, I don't want to go through those medical treatments. Otherwise, it's our default. Doctors have zero discretion. It's actually a crime for a doctor in the state of Texas to do not resuscitate order without a patient's permission. Like jail time. And that law got put into effect about 6 or 7 years ago. And it was a chilling effect on doctors writing these orders. No longer something I can do just by verbal. We have to get it signed. I have to get security guards to come watch you sign it. They can't work. There's a lot of laws about this. Or you can get it notarized. But the whole idea is it's something that takes some effort. It's something that takes some motivation, either from the doctor or the patient to do this. Yes?
So the DNR is part of the advanced directives, and that's not signed, that's not effective.
So the DNR is an order by a physician. So the advanced directive can help you in this regard. Remember I said the doctor cannot write the order without the patient's permission? All right, so if you have an advance directive, right, and say everything is fine, and all of a sudden it's not, and the doctor sees the advance directive, and the doctor says, listen, this situation I cannot fix. It meets the criteria for terminal or irreversible. That advance directive gives the doctor permission to write the order, but the doctor still needs to be the one to write the order. So the advance directive is a message to your doctor in the future. And by the way, you won't know who that doctor is. It'll be an ER doctor, it'll be a hospitalist, it'll be an ICU doctor you've never met. Right? So that advance directive is a message to them. Doc, if you think it's that bad, this is what I've done. Right? Either I don't care what you think, do it anyways. Or if you think it's that bad, doc, then please don't do CPR. It's a message to the doctor from you. If you don't have an advance directive, your medical power of attorney would need to talk with that doctor, and that doctor would need to get permission from the medical power of attorney to sign those documents. So you see, it takes a lot of planning, and it takes a lot of effort to do this. So that's why you do it way ahead of time when you're healthy, when you're able. So in Alzheimer's dementia, even at the early stages, people are perfectly capable of making these decisions, but somebody needs to bring it up. Somebody needs to ask, and nobody likes to do that. You know, back to the culture of South Texas, we don't like talking about death.
Nope.
We do not like planning for this. And that's why it results in the Valley being one of the most expensive places to die for Medicare beneficiaries. Notice that's not a good thing. Spending a lot of money on human life is not a good thing. You're spending a lot of money means we're doing a lot of machines and stuff that didn't work. The person still died. Other parts of dementia are not like that. We're a way big outlier, okay, from the standard of care. I wish we took that money and paid for care. I wish we took all those resources and paid for the stuff that actually helps people. No, we don't do that. So you have to navigate this thing. So Alzheimer's dementia, chronic progressive. There's vascular dementia, which is also very common in the Valley. It's caused by diabetes, hypertension, multiple strokes. Alzheimer's is associated with diabetes, hypertension, obesity, and strokes can progress it also. But vascular dementia tends to be okay and then bad, and then keeps declining in stepwise portions with multiple small or big strokes. Lewy body dementia, have you heard of that one? That one is almost like Parkinson's disease, where the dementia starts first. Typically characterized by vivid visual hallucinations and paranoid delusions. Not so much memory problems. Tends to happen in older age. And then there's frontotemporal dementia that tends to happen at younger ages, 40s, 50s, maybe 60s. And is first characterized by major personality changes, a disinhibition. The front part of our brain is what controls our impulses. And if it deteriorates, you start losing impulse control. You start changing your personality, doing a lot of weird things, very out of character. And it progresses. Those two last ones, Lewy body dementia and frontotemporal dementia, tend to progress more rapidly than Alzheimer's. So those illnesses need a little bit more emergency kind of planning, but usually by the time we're diagnosing those, the patient's already having major issues. Alzheimer's, by the time we're diagnosing it, tends to have a lot of short-term memory problems at the beginning. And so you have plenty of time to plan. Vascular dementia can be fine and then not. It's very difficult to plan it out. So those are the big overviews. I think we talked a bit. Yes?
Would ALS fall in that frontal?
No. So ALS is its own issue. Most patients with ALS don't get dementia, but a good portion do. Right? So ALS is the primary motor neuron disease where you can imagine that your brain and your body stop communicating. And you get this progressive paralysis that eventually will impact your ability to eat, drink, breathe. And we have the technology to keep people alive for many years and decades, even though they cannot eat or breathe, with machines and with artificial hydration. I have many patients with that illness, and I have these discussions with them. And they taught me something really important. Do not judge a person's quality of life by what you see in them. So I have patients with this illness who communicate with a computer that tracks their eyes, and they're very happy. They're very content in their life. They want medical technology to continue to prolong it. Right? Absolutely, that's what they want. But they have limits to it. And I help try to explore those limits. Right? And dementia, when it does happen in that illness, does change things. So that would be something I would plan for the patient. What happens if you can't do those things anymore? Because you can imagine some patients with ALS are completely cognitively intact. They just can't communicate like we do. So you still have to navigate those decisions. If a person's diagnosed with ALS, then I would have these kind of key point discussions with them. If you can't eat and drink, would you want us to use a feeding tube or not? If you could no longer breathe on your own, would you want us to put a tracheostomy with a ventilator or not? And that patient would have time, hopefully months or years, to kind of think about this. And that same thing goes for Alzheimer's. So those difficult decisions in Alzheimer's is usually going to come around to, if you can't care for yourself at home, how are you going to navigate that? That requires that planning because it's financial. And not everybody's blessed with either lots of money or lots of family. And if you have neither, then you need to do some financial planning to help navigate this. When the absolute end of life approaches, how do you want your doctors to treat you? CPR, no CPR, life support machines, no life support machines. In Alzheimer's dementia in particular, and I do want to bring this up at the time I have left, artificial nutrition and hydration. And Alzheimer's can progress to the point where a person kind of forgets their muscles don't work right anymore about how to eat and drink naturally. That things could go down the wrong way, and it could lead to pneumonia. In the valley, doctors will tend to say, and I've noticed this, the words that are used, they'll say, you need a feeding tube. You have to place a feeding tube. They'll say that. And you're going to, in families, don't forget, we're talking about families at this point. It's very rare that a person can make that decision themselves unless they plan it out. Well, if a family hears that, and we're talking about food here in the valley, that food is love. And I mean, what do you mean, I'm not going to feed them? Oh, then people end up with feeding tubes. The American Academy of Hospice and Palliative Medicine recommends against saying you need a feeding tube. Feeding tubes are an option, but it turns out feeding tubes in Alzheimer's dementia do not prolong life. There is no survival advantage at all. Because for every one person who lives longer for the feeding tube itself causes the death of others. So when you look at statistics, right, if I do this to 100 patients, or if I don't do this to 100 patients, and I say how many are alive in this group and how many are alive in this group, in dementia with PEG tubes, it's the same. PEG tubes are artificial feeding tubes into the stomach. So if there's no survival advantage, why are you telling people they need it? That puts an awful guilt burden on people. It's almost like influencing people to make these decisions. What I would say is it's an option, and it has good and bad. Surviving longer is not one of them. The choice is a feeding tube or continued oral nutrition and hydration, right? By modifying your risks. It's not feeding a person, okay? But if it's at the severe point where the person literally cannot eat or drink anymore, then it might be life-prolonging, but it won't prevent pneumonia because you still make tons of saliva every day, and the bacteria that gets into aspiration pneumonia actually comes from the mouth, not the food, not the water. So feeding tubes don't prevent the aspiration pneumonia. They do give you a way to put food, water, and medicines into the person's body, potentially prolonging your life at a risk of complications of the feeding tube, like the food you put in going back up the wrong way, it getting pulled out, infections, complications. So your trade-offs, nothing's perfect. So the doctors that the language that doctors use, right, can sometimes be a little bit manipulative to force you to do one thing or another. So talking what a person wants ahead of time and knowing that this is a potential treatment that might come up That's very difficult for families to make. The individual patient should make that decision themselves ahead of time. That's not covered by an advanced directive. Advanced directives in Texas are very broad. That specific issue needs to be discussed between the patient and whoever their medical power of attorney is. Okay. Any last couple questions? That's a lot of information.
So we're talking about quality of life.
And quality of life is very personal. Like I said, I don't judge people's quality of life. I don't look at a person and say, your life is good, your life is bad. That person, though, needs to be empowered to say, I think this is good. I think this is bad. I don't care what you think, doctor. It's my life, it's my body, I'm gonna make the decision I want. And notice I'm not saying do everything or don't. It's personal, but we need to say our defaults, what I would say, are incorrect. Our default in medicine, our standard here is not what most people want. And so you need to be empowered to put in writing, at least talk with your families about how you want to be treated. Because it might not be what our default is. And if it's not, then we're going to do a whole lot of stuff you didn't want. We might give you a quality of life that you don't think is good. Right? And you may not be able to then say anything about it. Especially if you're dealing with dementia. Right? You might lose that ability. So you make your decisions while you can, in advance. So it's called an advance record. And that was, yes.
Can vascular dementia be slowed down by memory pills?
All the memory pills are really for Alzheimer's. They don't slow it down. What they might do is preserve function a little bit longer at the trade-off of side effects. Right? There's always going to be side effects. The newest Alzheimer's medicines tend to cause brain hemorrhages as a side effect, for example. Right? But they're pretty effective at slowing it down. Vascular dementia is risk reduction. So reduce your risk of more strokes. So if you have atrial fibrillation, there's medicines for that. Diabetes, hypertension, controlling those other things to reduce the risk of multiple strokes slows down vascular dementia. Staying healthy, weight loss, reduces your risk of dementia overall. Now the newer medications, like you've seen those NFEG and all that, they're showing that they reduce the risk of dementia. How? It's all of the other metabolic syndromes that might be contributing to that. So all the prevention, it's usually just going to be not having diabetes, not having hypertension, or if you do, having it well controlled, keeping a healthy weight, being active, being engaged, keeping the mind going, staying good motor strength, strength training. All of those things actually work. I can't put in a pill and charge you a bunch of money for it. I could, you know, maybe I work in the pharmaceutical industry. Yes. Those are those new medicines I talked about for Alzheimer's dementia. And they're brand new, extremely expensive, right? And they probably prolong a person's ability to live independently or in their current situation by a few years, right? So they slow it down. That's probably the biggest effects you've seen on any dementia medicines at the expense of intracerebral benefits. Brain bleeding tends to be the big side effect because of how those drugs are working. They're going after the plaques that are thought to be the cause of Alzheimer's. And when they go after them using the immune system, sometimes bad things happen. But they work, it's just at what cost. And the cost was, when they came out, they were trying to charge $120,000 a year per patient. But they won't pay for nursing, just that's the joke I have about the medic. Yes, all right, well, thank you.
We have a lot of itching questions right now, so we're gonna go ahead and pass out some index cards, so that way if you do have any further questions, you can go ahead and write your questions down on these index cards, please. So thank you so much, Dr. Garcia, for putting this into a great perspective, right? What are some things we need to consider as part of making these difficult medical decisions, right? What is this brain area that we need to think about? So thank you so much, Dr. Garcia, and I hope you notes a lot of information from that presentation. I promise there's going to be a break that's going to come up very soon after our next presenter. So as part of our next presentation, I would like to introduce Belinda Lehanina, who currently serves as the operating director for Cornerstone Caregiving in Brownsville. With more than 14 years of experience working closely with the senior community throughout Rio Grande Valley, she is deeply committed to enhancing the quality of life for older adults and their families in addition. Belinda has spent the past 12 years serving in various roles within the healthcare industry, gaining extensive experience in patient advocacy, care coordination, and community outreach. Her primary focus is supporting individuals diagnosed with dementia and Alzheimer's disease by providing education, guidance, and access to valuable resources for both patients and their families. Drawing from both her professional expertise and personal family experiences, Belinda is passionate about helping others navigate the challenges associated with these diagnoses. She is dedicated to empowering families with knowledge, compassion, and support during some of life's most difficult moments. So without further ado, Ms. Belinda.
Well, good morning. Thank you so much for having me this morning. My name is Belinda Lehanina, and I am the operating director for Cornerstone Caregiving in Brownsville. My associates over here are CJ, would you mind standing, CJ? CJ Ariano is the operating director for Harlingen. And this is my assistant operating director, Tracy Mendoza, and she works with me in Brownsville. We also have a location in McAllen, which is Joseph Garcia, and he's not here today with us. However, he is the first office that we have here in the Valley. One of the things, I really appreciate Dr. Castillo giving all this information this morning, because 5 years ago, when my mother was diagnosed with COVID, I didn't know at the time that that was her, kind of the beginning part, the beginning stages of her dementia, I guess diagnosis or her journey. And that's where it all started. We saw things, we noticed things, we didn't really pick up too much on it because we were not very well educated. As mentioned in my biography, I've been dealing with seniors for about 14 years in different capacities, and worked with a lot of dementia patients, worked with a lot of Alzheimer's patients, worked with a lot of patients with different types of situations, illnesses, a lot of them end stage. However, I had never dealt with that in my particular personal life. Sure, I've had family members that have dealt with it. I've had uncles with Alzheimer's, aunts with dementia. But it wasn't until November that I started to see things really progress. When my mom was a real estate agent for 45 years. I'm sorry, a real estate broker. She was the matriarch of the family. Very strong. She was 111 and was the one that everybody went to. Nieces, nephews, grandchildren, we were all at her side, asking for that help, that information, her wisdom, her guidance. Amazing, an amazing person. But in November, so I should say this. So for about 5 years, for about 4 or 5 years, we saw her kind of having little issues here and there, not really understanding, not really realizing. Now remember, I've been in that situation. I've seen seniors go through all these different stages of losing cognitive or mental stability, understanding, you know, and so their ability to communicate and to understand, it's slowly shrank. Not my mother, right? But little by little, that's what was happening. So in November of this past year, that's when things started to get really, really bad. And so one day my mother, so for about a couple of months, my mom had been hallucinating and had been, she didn't recognize my father. She didn't recognize a lot of us, just a few of us. And realized that she had, really started to decline fast. I mean, it was really, really fast. And so in November, she decided to walk out the door and decided to walk to the bank about 3 miles down the road, all by herself, and I'm following her in the car with my dad. And I'm thinking to myself, this cannot be happening to my mother. This cannot be happening to a very strong woman that I know, that I love, has been there for everybody. And this cannot be happening to me. I've seen it happen to everybody else. I've watched everybody else go through it, right? But as she went and kept on going, I picked up the phone and I said, hey, so-and-so, I don't know what to do. Can you believe that? I've been working with seniors for 14 years. But it happened to me and I did not know what to do. So then, what I did was, she says right away, she says, Belinda, you need to this, and this. And I'm like, and I froze. And ironically, at the very same time that this was happening to me, I was hired to open up Cornerstone Caregiving in Brownsville to provide in-home care. And a lot of our clients have dementia and Alzheimer's. Well, at the same time this is happening to me, I'm looking at this location and my journey began. So we're trying to figure out, we're going here, we're going there. We decided to take her to a neurologist in Houston, where my brothers live. And they said, well, your mom has dementia. And that was December 23rd. We came back to Brownsville. She had, they gave her some medication, just like Dr. Presty was talking about. And, well, on December 24th, she had a very bad stroke. And as it was a crazy situation, we ended up in the emergency room. My mother was really, she just pretty much lost it. Got into the emergency room. It was just my father and my dad, 88 years at the time. I was 89. My parents have been married for 65 years. He was in the same predicament I was, right? Because I'm the only child that lives in Brownsville, as Dr. Gusty was talking about. There's a lot of family, but guess what? Sometimes one of us are the ones that end up with the challenge and the responsibility. Well, it was me. So my dad and I are sitting in the hospital room. My mom doesn't want to talk to us. She hates us. Excuse me, sorry. Is hating us. And when I went up, this is where it all started for me. I went up to the nurse practitioner. I said, my mom can't go home. She's very aggressive. And the nurse practitioner told me, she's never going to go. And my heart sank. So much I take it like this. Thank you so much. And at that time is when I said, oh no, this is not happening. And we left, went to the doctor, started getting a little bit more informed. I started getting more informed with fantastic agencies like the County County Health Department. Going to memory care meetings, one of the meetings that Vanessa gave, some of the dementia, what is it, that tour? The dementia tour, where you learn about what dementia patients are actually feeling, what they're going through, how their perception changes, how they can only see a certain way, maybe they have neuropathy, they don't function like you and I. So I had to really rethink and how I was going to help my mother. But most importantly was, if I knew how to help her back 4 or 5 years ago, when I realized that this was all happening, I think things would have been a lot less crazy for all of us involved. Because it was just family affair. I mean, I had my sister coming down from Seattle, my brothers in Houston. I mean, it was just, it becomes a huge family affair. But again, if we were to have actually taken a little bit or have a little bit of insight to it and understanding it a little bit more, getting a little bit more education from the people in our community, such as the Cameron County Health Department, Brownsville. I know that we have Caregiver SOS, we have Wellhead and Health. There's a lot of places that we can actually get help. If I would have taken that time, things would have been a little bit less difficult. Now, is it always going to be less? Is it going to be easy? Oh no. But it is so important to have these resources so that we can understand that this is not easy for the patient or the dementia patient. So, one of the things that I was asked to present on, because I'm with cornerstone caregiving, because we are a resource, I wanted to share with you not just my personal experience, but, not just how to prepare, but also wanted to give you my personal experience as well. So why is it important? And I'm probably gonna repeat just a little bit of what Dr. Castillo shared. Well, because over 55 million seniors are diagnosed with dementia and Alzheimer's. 55 million worldwide. That's a lot. That's a lot of people. Alzheimer's is probably the most common type of form of dementia. Early planning is really important because it improves quality of life for everyone. And what was, and I'm going to repeat what Dr. Castillo was saying, really appreciates the presentation. Quality of life is just that. Whatever you're used to. What are you used to? What is your mom, dad, loved one, brother, sister, whoever's going through it, what are they used to? So we want to keep that going as much as possible. Their quality of life. Progressive condition, it does progress. Because why? There's no cure for dementia. I wish there was, but there isn't. Not at this time. And their needs, they change over time. Whereas one day they're walking and the next day they're not. I know that my mom, she can't work the coffee maker anymore. I have to help her cut her food sometimes because the parts of their brain that were working before don't anymore. Okay? So, importance of early planning, more control over the decision making. Whereas, you're not rushing. If you've ever been in a situation where you're rushing to get somewhere and you make a last minute decision and it's not always the best decision, well, the same goes for planning in this type of care. Like me, I didn't plan for it. So what happened? We made a lot of not a lot, but we made some decisions that weren't always in the best interest. I didn't understand my mom either. My dad didn't understand my mom. So also it reduces conflict, not just between you and the patient or the dementia patient, but also with the family. If especially down here, if there's a large family, there's a big family dynamic, maybe, there's always that one alpha, the stronger the stronger, sibling, right? There's always that one that's always in charge or in control or has to have the control. So you wanna reduce that. Better financial preparation. I cannot tell you how many people I've sat with. CJ has sat with. Joseph, who cannot afford in-home care. Not everybody can afford Medicaid. I'm sorry, not everybody qualifies for Medicaid. Not everybody has long-term care insurance. Not everybody is a veteran. Okay, because we only work with private pay patients, veterans, and long-term care insurance. But there's so many people out there that don't qualify for provider services. And I've sat across almost every day, you know, we hear people all the time, this is too expensive. That's why it's so important to be financially prepared. You know, just like, I'm gonna repeat again, Dr. Vasquez, it would be great if we had a lot of money, right? But there's a lot of people, you'd be surprised how many people are not financially prepared for when this time comes. Improved coordination. One of the things that I've learned in, with my mom with dementia and different dementia patients, just in general, is the better the structure, the better the situation for them. Okay? The better the structure, the better their process will be. So the first step for planning is acceptance. It's probably the hardest thing to go through. Accepting dementia diagnosis in a loved one is the first step. Grieving the loss of who that person was is also part of acceptance. Realizing that they're not the matriarch anymore. Realizing that they're not the one who's going to give you advice anymore, but they're the ones that need help. Okay? When you learn how to communicate with them, connect with them on a different level, then you can understand what their needs are. You're gonna realize that where everybody else doesn't make any sense to them, if you take the time to actually learn to communicate in their level, their new way of and their new capacity of communicating, you will actually get through to your loved one. Second step is your healthcare planning. Discuss the diagnosis and treatment. Get as much information as you possibly can. Not just with your physician, but with advocacy groups. Those that do understand. Talk to people that are already going through it and ask for their advice. Discuss the advanced directives, just like that, and I won't go through that, but as previously mentioned, advanced directives are really, really important. Making sure you get power of attorney and end life preferences. Another step is the legal planning, and again, this is just repetition. And the reason why, because you'll be surprised how many people do not have durable power of attorney. And that's kind of like a general power of attorney, medical power of attorney, a living will, or any kind of HIPAA authorization. What does that mean, HIPAA authorization? The HIPAA law states that I cannot share any kind of healthcare information with anybody as a provider. However, if I want someone to know my information, I have to sign a form stating that I am releasing that option to my mother, father, brother, sister, husband, children. So you make sure that those HIPAA authorizations are in place, okay? Another step is legal planning. That was financial planning. Again, costs of care, meds, and housing. It's expensive. It's not just expensive to prolong a life, but it's just expensive to be able to get that additional care. Sometimes people have expensive medications, insulin, whatever it is that they need to be able to thrive while they're going through the process of dementia. And it's important to get all the information that you can. There are resources out there, such as people with, those that sell insurance, that, they have a lot of this information that they can really, provide you. Again, reviewing insurance. Sometimes you gotta look at the savings that y'all have. Sometimes y'all gotta get together. There's people who are left alone with just being able to care for that. Out of 6 siblings, there's that one person that provides all the finances, and I don't think we wanna be in that predicament. Financial advisors. We work with financial advisors because they're the ones who will put together a plan for those that need in-home care eventually, so that they can have access to, good in-home care, and not worry about where that money is going to be coming from. Choose the right caregiver. Let's see. Choose the right caregiver. Just take one more. That is probably the most important step, choosing the right caregiver. Some of us have family members, some of us don't. A lot of the later baby boomers generation, they're all retiring. Some of them are in their some of the silver generation. They retired years ago to the island and to, the south, a lot of the winter visitors came, they retired down here, and all their families stayed up here. And we have a lot of clients like that we're taking care of because they don't want to go back to where they came from, and the children don't want to move down. So there's that divide, and so that's when Cornerstone steps in to take care of their loved ones. And so choosing the right caregiver is so important because you're leaving your loved one in this particular stranger's care. And so that's where Cornerstone comes in. There's also, like I mentioned, there's adult daycare centers also. Support groups. Keep in mind your support groups. In Brownsville, I know that in Farmington too, there's a lot, but like we have in Brownsville and in Vista, we have memory cafe, there's some support groups, there's Caregiver SOS, that is here south in South Texas, and helping out with caregivers. There's the Alzheimer Association. Become informed, get as much information as you can, because it's gonna help not just your loved one, but yourself, your family members, and all those that come in contact with your the dementia patient. One of the resources that we have is called the GUIDE program, and this is provided by Medicare. So if you're a caregiver, not paid by anybody, and you need some help, the GUIDE program is for those Medicare patients that have traditional Medicare. It gives about, I think it went up to 2,650, right? A year of paid in-home care. So this is really important for those Medicare patients that need, or for the caregivers that need a little bit of help. They need to go to the doctor's office. They need to go to, they have their own shopping to do. They have their own things that they need to get done, but they have not been able to because they didn't take care of their loved one 24/7. So it is real help, it is really neat. We do have sign up if you have anybody that you want to sign up for this Medicare program. We are available back, we walk out with me over there, myself, CJ, and Tracy, and we can sign you up. If not, if you don't want to sign up at this time, we can give you some information to give us a call, and it's a very simple process. You just put the name, I think their Medicare number, Mr. CJ, and their date of birth, and we submit it to get their information. We submit their information to see if they can qualify. Okay. And again, just stop by our booth and let us know. And that's something that we're really trying to promote. Just a side note, because it's a federally provided funding. Only the national companies. One of the things I didn't mention is Cornerstone Caregiving is not a local company. We are almost 500 locations nationwide. We're actually international. We have an office in Canada, and we go as far north as Alaska. So we're a huge company, and that's why we're able to work with this particular program. So take advantage of it for your loved ones if possible. And like I said, come see us out there. So again, the takeaways, just remember to plan early. Remember to address your legal, medical, and financial situations. Find a reliable caregiver and use resources such as the one we're offering today as the guided program. So, any questions? I think my time ran out to work that. Yes, ma'am.
Anything over this, do you want me to read it or? I will give it to her. Is that okay? Yes.
Maybe that, yeah, maybe that.
You want me to read it out now? Okay, so the person has no way to make decisions for them, and they know that and they know that their memory is failing. Who is there to take care of them? Does Cornerstone handle this? So we don't handle those particular things. I do want to say we have helped a lot of families to lead them in the right direction. As far as like sending them the right resources. We had a client last week who was passing, and we got them their hospice care right away. We can help them find the right agency to be able to help them. We do cover that. We're, you know, I want to say that Cornerstone prides itself on being not just a resource, but knowing who to send them. And, you know, it's worked out great. So, yes. But Cornerstone will direct, either send them the right direction or will bring somebody to them. Thank you for your question.
All right. Thank you so much, Ms. Melinda. Let's go into All right, everybody. So right now we're going to go ahead and break for at least 10 minutes. If you haven't already, please take advantage. We have some color cards and those little white faces on the tables or your colored pages if we haven't realized the color yet and we'd like to. We also have a wellness room, so if you would like to join Warriors of the Cornerstone, it's doing additional activities. We have this room for individuals living with dementia to kind of sit, relax, as well as their caregiver comes out and wants to meet the coffee. But y'all are more than welcome to go ahead and go to the wellness room and check it out. Please also feel free to go check out the vendors if you haven't already. Stop by the tables, see what resources they have for you all. And then we'll go ahead and bring them about thank you so much. Rio Valley School of Medicine in the Memory and Aging Center of Arlington. She has received a bachelor's and master's degree in physical education from Eastern New Mexico University and a Master of Public Health degree in Health Promotion and Policy from the University of Missouri. She is currently working on an editorial degree in gerontology and was confirmed as a PhD candidate at Cornell University in Chicago. Her work efforts at the Memory and Aging Center focus on the community in outreach, engagement, research, and education. Her research interests are focused on the aging population in healthy aging, Alzheimer's disease, dementia, community engagement, women's health, family systems, social support, cognitive health, health promotion, decision-making, and the generational and cultural influences that protect the factors associated with aging. Prior to working in research, Ms. Stein was taught at UCRGV in the Health and Human Performance Department and as an adjunct faculty member for the UCRGV Occupational Therapy Department. She enjoys interdisciplinary academic work and collaborating with others. She is an active volunteer in the community and encourages community engagement to her students on a regular basis. She is a founding member of the Senior Advocacy Coalition, which partners with the Cameron County Public Health, City of Brownsville Parks and Rec, AARP, and other entities to make Brownsville more age-friendly. Ms. Stein is an active member of the Healthy Communities of Brownsville Board and has served as board president since 2016. In all of this, she continues to promote healthy living, community engagement, and service to her students and those who know her. Let's go ahead and welcome Ms. Stein.
Great, thank you, Cheyenne. I'm very happy and privileged to be here today. I see a lot of some familiar faces already this morning. So good morning. As Cheyenne said, I am Kendra Stein, and I am as you can tell from that, a very involved person. I have been working in the valley now for, goodness gracious, almost 20 years. And I have always had a passion of working with the older adult population. So things have come full circle, and I have been able to enjoy the work that I do in the community. So today I'm going to talk to you a little bit about, as my background, as you heard, is a lot of health promotion, public health. I've taught health education for many years. I'm going to talk about the importance of being engaged and engagement. There is research out there and evidence that shows that the more people are socially engaged and interact with others, that it also helps to improve the brain, it helps to improve your overall health, your physical health, and your emotional and social health. So I'm going to talk about the importance of staying engaged as you get older, and being part of the community, right? And how that can be beneficial. So first of all, I just want to tell you, this is just a slide agenda as falling back on my teaching skills. And I always have an agenda, and for every lesson that I talk about, and I would always tell the students, well, you know, a lesson is just like a plan, you know. So and if you did it out in the community, you would have a plan that you go through. So I always have that agenda when I start off. So a little bit of what I'm going to be talking about, as I said, what is engagement. Maybe also how the individual engagement versus community engagement. A little bit how individual engagement can affect our lives as individuals and our health, right? And how it can benefit our health, as well as talking about, you've probably heard a lot in the news about isolation, and how isolation can be a negative, a bad thing for us in our health. And so I'll talk about a little bit of that, and looking at the how that can help to, well, how we can do things to get out of social isolation and be more engaged and be active. And then how that relates with being involved in our communities and community engagement. So what is engagement? How many of y'all are engaged, do something on a day-to-day basis? You could say this is an engagement activity, right? You get to meet people, you're going to see the vendors, right? How often, have you thought about how often you do something like that, right? And what are the benefits of that might be? So engagement is done a lot on an individual basis, but it can also be done on a community basis. So as it says, engagement is the action of engaging or being engaged, and it means of participating, it means of sharing and being part of something, right? Because it's important as human beings to socially connect with others, right? Many of us might have a church or a religious affiliation that we are part of, that we spend a lot of time with in the community. Some of us may have groups that we like to go and exercise with, you know. I know some folks who would like to have, you know, social groups with coffee a certain day of the week, or to meet for breakfast one day of the week. These types of things, whether we're thinking about it or not, help to improve our health, right? They interact, they get our brains going, they get ourselves moving. These types of things, by participating and being part of something, we are able to not only be healthier and more engaged people, but we are also able to have those connections with others, right? So, sharing, you know, if you think about it, you know, as I said, as human beings, we are relational individuals, and it's important for us to have different relationships and different connections with others over the years, right? And so community and sharing with it and being an active person in that regard is important. So, as it says, as individuals, we like to be engaged with others, we share, we take part in activities, whether it's through exercise, through social events. These types of things allow us to be healthier individuals in a lot of ways, right? It's a lot different than being at home and being isolated and not going out or not being around other people, right? I did some work in the past with what's called the Livable Communities Project, the ARP, and part of the aims of that was to connect communities and connect people with each other, right? And to better the livability of the community, right? By providing more access, greater access to things. So social engagement, when you think about it, is very important. So it's not only, as I said, important for the health of the individual, but it's also a way that we can stay socially connected with each other, other people, right? Who are important to us. Now, if you think about it, we all have different amounts and different numbers of communities, right? So it's important that we keep those ties, and that not just for our social status, right, or our social activities, but it's important for our health. Sorry. So it's definitely important. And so the World Health Organization, if you've heard of that, which is one of the largest health organizations in the world, that's the World Health Organization, as a professor, I always used it because they do a lot of things that we call our evidence-based, meaning that if it has been done, if a program has been done, or some research has been done, and it has proven to be effective, then it can be used again, right? Because as educators, as an educator, we always wanted to do, I always wanted to use evidence-based information because it was something that had been proven to be factual, right? That it works. So, it's always best to look for programs and activities that have been proven to be effective. So the World Health Organization defines They say social engagement, they refer to it as a social connection. That is a way that we can relate to people and interact with others. And without social engagement, as it says, an individual can suffer, like I mentioned before, from social isolation and loneliness, right? Have you ever known someone to be lonely, to be isolated, who may not have the ability to get into the car and drive to the store for resources, or drive to an event at church, or drive to the park, to working, to meet with other people, right? Loneliness can be very isolating, right? It can be very, it can physically affect our lives. And so it is something that we, I recall working through the pandemic as a teacher, how there were many students of mine who you could start to see some of the physical effects on the isolation of staying at home all the time, right? And so loneliness is a painful sense feeling that comes from having that lack of social connections. So loneliness, and so having social connections, as it says, is a way that we can stay engaged, as I mentioned, and it has it can affect our health in many ways. So what we need to do is as individuals, stay more connected, stay more engaged, be sure that you are finding communities and different activities that you can participate in to help you have more engagement with others, or and better health, right? Because there's some evidence that show that if we are more socially engaged and are around other people, the better off our health can be. Okay? So by strengthening our social connections, we can build community and have that community, healthier communities overall, right? Because if we have many people here, right, are parts of communities, right? Because individuals make up a community. So evidence has also shown, work at the Alzheimer Center, that social media, social engagement helps to reduce the risk for stroke. It helps to reduce the risk of heart disease, because if we are more engaged, we can have better health outcomes, right? And so I think we've talked about this a little bit, that at the individual level, we can improve our health status, and we think of how our individual health, a lot of times, that's kind of just maybe our primary concern, but we don't think about our social health, right? I did a lot of work in wellness, and in wellness, we talk a lot about how there are different types of health. There is physical health, there's emotional health, there's intellectual, there's social, there's environmental, you can go on. But because all of those things, whether we realize it or not, those different aspects of ourselves and outside of ourselves affect our health. So one way we can stay involved and engaged with individuals, like I said, is to be part of groups, but also to go out and volunteer, get to know other people, right? Make the connection. So, as I was just saying, health is not only the physical and the mental and the social well-being, but it also includes opportunity and availability to resources, as Ms. Trevino from Community Connection was saying, right? Resources available, right? Taylor, right, sorry, about how the more resources we have and opportunities, it can help us to be more well supported, right? And so kind of getting in a little bit of more academic, we have these things that are called social determinants of health. And social determinants of health are just that. There are things out in society that determine our health. So like I was saying, a social circle, or being part of a group and getting outside outside your home and going places, that betters your health whether you realize it or not, right? So I will skip this, but as you can see, social determinants of health, these are the different parts, the different determinants that can affect your health. Besides being socially engaged in our communities, partnerships and collaboration, infrastructure, what resources we might have, any type of policies that might affect us, all these things in that circle right there can influence our health in many ways. So, neat statistic that I found too is that social determinants of health account for between 30 to 55% of health outcomes. That's that's anywhere from a third to a half of what our health outcomes are in our lives, right? And so it's important that we stay engaged. So now as individuals, we are part of communities, we are part of groups, right? And all these individuals make up the community's health, right? So in a lot of work I've done in community engagement as a volunteer and as a professional is going out and connecting with other people. So that has helped me as my health as an individual, but it's also helped to improve the health of the community, right? I've done a lot of work in Arlington and Brownsville. In fact, I know everybody from the Cameron County Public Health because of that, right? And our working together and collaborating to do those things. So if we have many individuals within a community who are engaged, then we have healthier communities. So as I said, the World Health Organization, I put another quote here, that community engagement is basically, as I said, the process for developing relationships, enabling stakeholders. Each and every one of you are a stakeholder in your community or your business or in your family. You have a stake in how things happen, right? And how they can affect your health. And so, as stakeholders, we, within the community engaged, we can do more and more things together, right? It's about collaborating and working together to overall help the health of a community. So, as I said before, by participating in community engagement, it can also help to change health behaviors. So a lot of work that I've done in the community by promoting health and educating people about health, I have been a change agent or an advocate for improving the health of my community, right? And so community engagement, as an individual and as someone who is part of different groups that are involved in community engagement, we can help to help people change and have healthier behaviors and help people to have better health outcomes. Okay. So I will skip, I think I get a little short of time. But one of the things I wanted to point out too is someone through community engagement and promoting social engagement, there are 5 principles of well, actually I just numbered them. There are 7 principles of community engagement that I'm familiar with that like also promote helping people to improve their health, and which not only is about improving your brain health, but improving your physical health, is building relationships, as I said. It's being culturally sensitive, recognizing other people's beliefs and their practices, sharing in the decision making, right? Working with others in partnership in communities to plan, implement, and work with health programs like we do with Cameron County and with Alzheimer's Association, you might see. Ensuring that everybody is included, right? That all ages are involved. There's a lot of work out there now. With intergenerational and multi-generational programs, because they have found through research and evidence and programming that if older people are more involved with younger people and there's a mix of generations who are working together, that there are indeed better health outcomes for those folks, right? And a fifth thing is recognizing the community's knowledge, the overall knowledge within the community about how people can contribute to make it a healthier community. Then, as I said, I gotta repeat. So actually, the two on the right are repeating the two on the bottom. So my football is late night and not enough coffee. But again, I was very honored and felt privileged to be asked by Cheyenne and her team to come and speak to you. I try to be the biggest advocate that I can be for health and helping others to have better knowledge about how they can better their health and how they can be more engaged with others, which will help to prolong their health, right? So I thank you for letting me participate and speak with you guys this morning, and if I can help, please let me know. Thank you.
Thank you, Ms. Kendra. You know, we really don't realize how much of a benefit engaging with others, right? Talking to someone, getting outside of our home, doing things we love, actually benefits our lives. So we thank you, Ms. Kendra, for putting that into a different perspective, really realizing how much of a difference that can make for our health. While we go ahead and transition into our next presenter, while we get ready for them, let me go ahead and introduce you. So for our next presentation, we will have Victoria Herrera, who is a speech language pathologist and has spent the past year and a half working closely with older adults, including individuals in the early, middle, and late stages of dementia. As a speech therapist, she provides cognitive training, teaches practical compensatory strategies, and supports families and caregivers in understanding how to care for someone living with dementia. Victoria is passionate about helping people stay connected, which we just talked about, supported and understood throughout every stage of the disease. Joining Ms. Victoria, we will also have Alexandria, who is an occupational therapist with over 10 years of experience, including 7 years specializing in the skilled nursing facility setting. She is a certified lymphedema awesome. Therapist and currently serves as the Director of Rehabilitation, overseeing both inpatient and outpatient therapy services. Throughout her career, she has focused on providing compassionate, evidence-based care to the geriatric population, with an extensive experience treating individuals living with Alzheimer's disease and other forms of dementia. Alexandria is passionate about helping older adults maximize their independence, improve their quality of life, and maintain meaningful engagement in daily activities. Her professional interests include dementia care, caregiver education, functional rehabilitation, and interdisciplinary collaboration to achieve the best possible outcomes for patients and their families. We're very excited about another wonderful presentation, so without further ado, let's go ahead and have Ms. Victoria and Alexandria.
So I'm Alex, I'm an OT, I work at Golden Palms. Oh, we can. Do y'all hear me better with this one? Or I just need to speak louder? That's better? Okay, thank you. So my name is Alex, I'm the OT at Golden Palms. For those who don't know about Golden Palms, it's both an assisted living, independent living facility on one side, and on the other side, it's a nursing home, skilled nursing facility. It's a 60-bed facility on that side, and we house both long-term residents that require more advanced care, and a lot of that population are individuals with dementia or Alzheimer's. And then we also do short-term stay residents that come from the hospital with more acute issues, maybe they've had a surgery, an infection, different things that they need in the hospital, and they just need to get better to be safe at home. So we provide that care. Those individuals at times do also have Alzheimer's and dementia that need their interventions catered to them in order to follow through with certain precautions and things prescribed from their physicians that they might not be able to recall when they're at home. So that's just a little background. Later, Norma, our senior living executive director, will talk a little bit more about the assisted living, independent living side of this living. And she can give you a little more on her background as well, because I think y'all missed some of that information. So the impacts of dementia on daily life, they vary individual to individual. And I'm sure y'all know a lot of us may have already gotten some of the information, but you're at an increased risk for falls. They might be a little more impulsive. You might forget to turn a light on, you might forget that there's a rug in there. Just all these different factors that can go into why they might have a fall. Sedentary lifestyle, it kind of ties into decreasing engagement, social activity, and meaningful hobbies. So they're not leaving their home as much, they're staying in, they get a little more comfortable in that recliner, and they're not being active as much. So that can also go into your mood and behavior. If you're not having a social engagement, you're not leaving the house as much, your mood and behavior can change as well. So you might be, you might become a little bit depressed, might start feeling down on yourself, might not have somebody to talk to about what you're going through. You might have changes on your temporal orientation and change in sleep patterns, so you get confused on the time of day. You're sleeping more during the day versus sleeping at night. And not having a healthy sleep pattern also affects how your brain functions. So that impacts you as well. Difficulty completing activities of daily living, you might not have the volition to do it. You also just might forget the sequence of things, forget where you put things to be able to complete them. And then just memory loss affecting routines, you might not be as safe. Difficulty with word finding, so you can be having a conversation, you completely lose where your track is going, and you get frustrated with yourself. Problems with attention, concentration, again, having a conversation, somebody saying something, and your mind's thinking of something way different, and you lose engagement in the conversations you do have. Reduced ability to prepare your meals, manage your medications, you forgot to take your medications, you're double dosing, you end up going to the hospital because you either forgot to take them or took too many, right? And increased caregiver burden, so your families are having to come in, help you more, and they might not have the time for it, and you feel like you're a burden to them also, right? So with that being said, resources you can So things we offer at Golden Palms, on both our inpatient side and our outpatient side, we offer physical therapy. We gear it towards fall prevention, working on your balance, maintenance of functional mobility as long as possible. I mean, there are going to be functional declines as we age, but we try to keep you as healthy and as strong and moving as much as you can throughout your lifespan. Caregiver training, we try to make family members and providers and teach them strategies, making sure that when you go home, it's carried over into the home. Strengthening support transfers, walking, engaging to improve safety, transfer training to different, I haven't felt comfortable getting in the car. Okay, well, bring your car over, let's help you, let's figure out how we're gonna get you in and out of the car. Improved endurance, your postural control, your activity tolerance. So as we age, we tend to hunch down more and more. And when you do that, you're offsetting your balance, right? So you're tilting forward, you're at more of a risk for falling forward. Pain management, flexibility, range of motion. We work on building your confidence so that you can feel comfortable going out in the community, navigating the parking lot, going to the mall, whatever it is that you'd like to get done, but you feel that confidence to do it. And training with adaptive equipment. So as we age, you might now need a walker or a cane, whatever it is, we train you to this, so you can do it safely. In the pictures there, you'll kind of see the first one. She's working on that posture because he did have his feet posture, she's corrected and standing up a little bit taller. We'll work on your balance. She has on the bottom picture, she's stepping over hurdles, so making sure you're able to lift your feet high enough. And what you won't see in some of these is the challenges they give them cognitively as well. So it's following a sequence. You're stepping over, now tap this. You're stepping over, look for this. And there's just different things we incorporate to not only challenge you physically, but challenge you mentally as well. So occupational therapy, somewhat similar to PT, we will work on your balance, but we'll also incorporate a lot of the cognitive and sensory based. Sometimes those with dementia have a little bit more confusion, altered mental status. We try to just reorient and provide them with calming effects so that they can focus and pay attention to tasks at hand. We educate them on adaptive equipment, improve performance with ADLs and meaningful tasks and hobbies, and we like to keep them engaged. They like to go to bingo, we like them to go to bingo, right? Development of compensatory strategies, caregiver training, environmental modifications. If you've tripped 3 times over that area rug, it's time to get rid of that area rug, right? Because a trip can lead to a fall, which can lead to a fracture, and we're all about keeping you safe. So if you feel like your home needs modifications, we can give you advice on how to make it safer. Motor sequencing tasks, balance coordination, and functional mobility. So what you'll see in the first one is she's not just going to have you do an arm exercise. She's going to make you do an arm exercise while stepping forward, right? So it's working the brain. You're doing 2 things at once. You're lifting the weight and stepping forward on a stool. So she's like, tap that step, come back down. But you're doing 2 things at once, making your brain work a little bit harder sequencing that task. Now the bottom one, you'll see her having her squat, tap the ball, get up, take steps forward, squat, tap the ball. What you don't see is right after she did that, she has her walking backwards. So there's research studies that show walking backwards actually challenges and improves cognitive function. So we incorporate, and we always are constantly researching ways to work on cognitive function. So we're going to put that in our interventions and work on that as well. So speech therapy, I'm going to have Tori here speak on that.
Testing. Good afternoon, everyone. Thank you for taking the time to be here. I'm a speech therapist working at Golden Palms, and my area that I specialize in right now is dementia care, mild cognitive impairments, and Alzheimer's. So the first slide I want to talk to you about is the improving communication and of wants and needs. As the brain ages, normally it becomes harder for us to communicate to our loved ones, to our friends, to anyone in our environment, our needs. And speech therapy can help provide strategies and visual aids to help communicate. Another thing that we like to work on is word finding. As we age, we have that normal tip of the tongue phenomenon. Oh, I know your name, I just can't think of it right now. I saw you last week, and that's a normal process that everyone goes through. But word finding constantly probably might need some extra help for finding those words and communicating always. We all have a voice, and a motto of mine is, I want to help you find that voice. And some of us might have those embarrassing moments and senior moments, and that's a normal process, and speech therapy can definitely help reduce that frustration and reduce that embarrassment. And another thing that will help is what we're doing right now. We're providing community, and we're providing the space to talk about the deficits that we may be going through. So enhancing that social participation, meaningful conversation over a phone call, over a video call. Speech therapy can help. Speech therapy can help a lot with finding those areas deficits to help communicate to your loved ones. Another aspect as a speech therapist, I work with feeding and swallowing. As we become older, our senses are heightened, so maybe that food is way too hot and it decreases our appetite. That food is way too sour, we don't like that. The consistency tastes inappetizing in our mouth, so as a speech therapist, I provide modifications. Maybe we can't cut up our steak, so we'll put it in bite-sized portions, and that helps. There's a normal process of swallowing, and then there's an aging process of swallowing. Sometimes our swallowing becomes more difficult, so we might need to modify our liquids or modify our food in general. Another area I'd love to work on is cognitive training to a simple task like coloring a page or the wonderful activities that were provided outside, puzzles. It can be a bit more complex, like providing bills or providing a schedule, organizing your pills throughout the week, and cognitive training can really work out the brain. The same way that Alex described physical and occupational therapy, speech therapy is working out that brain, providing those processes and allowing the brain to work and those gears to turn. As a speech therapist, we provide puzzles, games, always going back to the functional purpose of why we're doing this puzzle, to help the cognitive process, to reduce that risk of decline. Our brain ages normally, and as we would like to help decrease those frustrations and decrease those deficits. Another implementation I'd love to talk about is memory books and visual aids, sticky notes, big posters of remember to turn off the lights, remember to call the doctor, reschedule the appointment. Visual aids are great. Another area that I worked on with my patients in the skilled nursing facility is a reminiscence therapy. We have little emojis for their privacy. This is something I created for my patient living at the nursing home right now. She had moments where she could not recall where she was. She had heightened anxiety looking for her children. So I asked family members to send me photos so we can decrease that anxiety. This is a scrapbook that we put together with simple pictures and print, starting with my name is, with a photo of herself, and I had her read each page so she can decrease that frustration. The second page was, I am from, and had her hometown, and reorientating her back to, I live here at Golden Palms. That definitely helped her calm herself and allow that safety and that well-being to come back. This patient really enjoyed looking at photos of her family, and she told me she felt safe, and she asked me if I knew her children, and I said, of course, yes, your children come in and visit you. Here's a picture, and right here where I live at Golden Palms, I was outside of Golden Palms, so she recognized that tree that the children came to visit with her, and recalling her birthday, recalling her favorite activities to do. So reminiscence therapy has a lot of research showing the benefits of preserving that long-term memory is one of the last functions that we have as being short-term. It needs a little bit more work, but long-term is something we would love to preserve and giving them overall better quality of life and a safer environment. Thank you so much for listening to me. Now this is Norma.
Okay, I will not take long, I promise. How are y'all doing today? My name is Norma Crowell. I'm the Senior Living Executive Director, and let's hear it for Golden Palms. So, Golden Palms, as these lovely ladies were informing you, we do have levels of care. independent living, assisted living, short-term rehab, long-term care, inpatient therapy, outpatient therapy, aquatic therapy. It's a one-stop shop for seniors. I've been working with seniors since 2007 when I started working here at Golden Palms, and I started working as a director of marketing for skilled nursing, so it was short-term, long-term care. And I started understanding the spectrum of senior healthcare and how it affects everybody differently. Then I started doing the assisted living, management side of it, and just understanding the entire circle. I have learned so much about seniors in these past 20 years. I've done so many tours, I've moved in so many people. People walk in those doors, and it might take, in senior healthcare, for someone to decide whether or not they want to leave their home and move into a senior living community. 2 years, maybe 3. Because the first thing that they tell me when they're touring, I'm not ready yet. They're living alone, they're lonely, they've lost a spouse. I can already tell there's some signs there of some mild dementia, right? And of course, it's always a resident's decision when they're ready. So Golden Palms, I can tell you all, we have a wellness program, activities program. We have over, I think, 6 residents that are over 100 years old. And we have another resident turning 110 in August. Do any of these residents have mild dementia? Yes, they do. We keep them very busy, and you would never know. So that's why I'm just here to say, if you're ever interested in learning more about what we offer, as I said, we are a one-stop shop. Come by, see us, or speak to any of our residents that are here today. So thank y'all.
Hi, good morning. My name is Jacob Cat. I'm the director of marketing for Golden Palms Patient Rehab. And basically, I'm the guy that interviews you at the hospital. So I kind of have compassion and understanding for where they're coming from and the therapy that they're going to need. So we try to get them in as fast as possible and get them to their goals as fast as possible. And sometimes the families want to take them home right away. So we just have to let them know that they're there for a reason. The doctors prescribe it, patient rehabilitation, and that's what they're there for. I wanted to thank you guys so much for listening to us. Please let us know if you need anything. Thank you.
Test. All right, who's hungry? Oh yeah, okay. So we have 2 great things going on right now. Okay, one of them, we are going to go ahead and get started with lunch. Very important to note, you should have been provided a red ticket at registration. Okay, for lunch, make sure that you have your red ticket. We're going to go ahead and start with these 3 tables over here on this side. So you're going to go ahead and present your ticket, and then they're going to go ahead and provide you with your lunch, okay? While that's going on, while we're waiting over here for it to be our turn, we're also going to be passing out some Romania cards, okay? Let the team know whether you prefer an English card or a Spanish card, and we're going to go ahead and be passing out 1 card per person, okay? It's part of our next presentation activity. Okay, so once again, we're going to go ahead and get started with these first 3 tables over here for lunch. Please make sure to take your red ticket to this lineup. Over here, be ready for them to come and ask about the red ticket. Okay, we'll go ahead and get started with lunch.
No, I can do it in Mississippi River. Yeah.
Thank you so much. Yes, thank you.
Oh, that's
Yeah.
Oh, no.
English is bad. Nothing. You should see what he does to. How many do you need?
I think they're gonna start it in church. I think they're gonna post out something. They should.
Here you go, here you go.
All right, our last two tables will go ahead and have y'all to go ahead and get some lunch, okay? We're gonna finish passing out the rest of the cards, the Romanita, and then the little placeholders. But while we finish those items out, I'm going to introduce our next presenter. All right. So for our next fun and interactive presentation, we will have Maxine Vieira, who brings nearly 13 years of experience with the Alzheimer's Association and more than 30 years in the nonprofit sector, with the past 22 years focused on addressing the complex needs of an aging population. In her current role, she works to expand access to Alzheimer's care and resources while promoting the critical importance of early detection so individuals can benefit from emerging and newly approved treatments. As a dementia care practitioner, Maxine provides education and guidance to newly diagnosed individuals, family caregivers, and professionals seeking to better understand the disease process and effectively manage behavioral symptoms. She is also deeply engaged in public health capacity building, mentoring local public health departments to strengthen their understanding of dementia, that is for sure, and integrate into broader community health strategies. Through this work, she helps public health leaders navigate everything from awareness and risk reduction to early diagnosis, care planning, and community-based support systems, ensuring dementia is addressed as a growing public health priority. Maxine's passion for this work is both professional and personal. During her career, her own mother was diagnosed with Alzheimer's disease, and she experienced firsthand the same challenges faced by the families she supports, despite having knowledge, resources, and a strong support network. This experience continues to shape her commitment to advocacy and system-level change. Today, Maxine is especially dedicated to reaching minority, underserved communities, working to reduce disparities in dementia care and access. Lastly, Ms. Maxine carries this mission forward in honor of her mother, when millions of families navigate this disease. So without further ado, while we continue to enjoy lunch and have a great activity, let's hear it for Ms. Maxine.
Well, hello everybody, please continue enjoying your lunch. Thank you for those kind words, Diana, introducing me. The Alzheimer's Association as an organization will always try to find interactive ways and interesting ways of how to engage the population in not a very clinical educational needs, but in fun ways. So that we just released what we call a loteria in Alzheimer's disease. So that's what we're going to do in a few minutes. I wanted to do the presentation this kind of way. All of the speakers today really connected the work that we're doing in Healthy Brain, right? It's important that we learn how to plan accordingly before we're in crisis. I think we don't like to talk about death. We don't like to talk about how we would like to be if we cannot make decisions by ourselves. But it's a very important conversation, right? We talked about the different forms of dementia. Did you know that Cameron County has a higher incidence of dementia than any other county across Texas? With 14% on average. That's higher than the state of Texas. When we talk about statistics and high incidence of Alzheimer's disease, it is important that we become better prepared to handle these diseases in the crisis. And then we talked about the different forms of dementia. Unfortunately, Hispanics, yet again, have a higher incidence of dementia because of the risk factors that we face, whether it's diabetes, high cholesterol, any condition that's going to affect the flow of oxygen to the brain is going to be a risk factor for all of us. And then, how Kendra talked about engagement. This is a major factor in how we start to age in our communities. One of the things that was very very eye-opening during COVID is that the caregivers and the person living with Alzheimer was severely affected by isolation more so than the disease itself. Caregivers did not have an outlet of where to go, and they were stuck in an environment where they had to care for their loved ones, obviously, but they didn't have the means to go and take opportunities elsewhere. And then we talked about, becoming or taking advantage of therapies such as occupational therapy, speech therapy to help the individual with Alzheimer's disease retain some of that independence until they can no longer be able to fully independent. So that being said, I will talk to you today about a little bit of the health training. So you can enter. No hay premio. El premio va a ser la educación. No prizes, just education and the work. So let's talk very briefly about the healthy habits for your brain. Last year, we published the results for the US Pointer. The US Pointer was a study that was conducted over the 5-6-year period in which we studied the results of lifestyle interventions. We learned about nutrition, the value of nutrition. We learned about healthy habits such as learning, continuing education. If you've never spoken English, maybe you want to learn how to speak English. If you're already fluent in both, maybe you want to learn what could be the hardest language to learn for you. Is it German? Is it French? Chinese, right? Or Korean. There's so many good K-pop dramas on Netflix, and either you have to watch those titles, but wouldn't it be better if you can actually follow because we learn the language, right? So as we learn all of the benefit of these lifestyle interventions, there's value in adopting healthy habits for our brain, for example. Control your blood pressure. How many of you, you don't have to disclose it, but are already having to take some medication, right? And what is the first thing that our doctors say? Manage your diet, make sure that you incorporate some sort of exercise. And exercise doesn't have to be getting ready for a marathon. It could be a 15-minute intervention in the morning, like maybe you adopt walking, or you want to go 15 minutes in the afternoon. Take advantage of the cool mornings because we're reaching the time when it's gonna get very hot, right? Managing your diabetes. How many of you are controlling your diabetes properly? If a person has already dementia and they do not control diabetes properly, the behaviors are going to be more difficult to manage throughout the day. So it is important that we continue to maintain these conditions even during the journey. Maintaining a healthy weight. Healthy weight can mean many different to different people. Some people are very healthy, either 150, 160, and some people are very healthy, they're in 120, 130, whatever that looks like. Again, having these conversations with your physician to making sure that you connect back to what healthy looks for you and adopting a plan that's going to work for you individually is the best conversation you can have with your physician. If you're smoking, I'm sorry to say this, can we adopt a smoking cessation plan? How many of you, I can share my experience. My father was a heavy smoker for many years. And the day he decided to quit, not only did he go through the symptoms of having to stop smoking, but so did we. And I wasn't smoking, but this both was in the house, right? Again, anything that's going to affect that flow. Getting moving, we talked about that. Eating right, sleeping well. How many of you go to sleep early in the night, like 8 or 9, 10, midnight, right? 2 in the morning, 3? Yeah, sounds about right. And how do you feel the next morning? Not good, right? Groggy and whatnot. So adopting healthy habits, like when you go to sleep, like not having your TV in a room, for example, is highly recommended. I know that many times, like me, I need noise. So sometimes I just have the TV on for the noise purpose. But if you dim the light in the TV, it can help you adopt some of those healthy habits. Chatting maybe continue to read, and things like that. There is research to back the higher the education, the later, it delays the onset of the disease. And then also protecting your head. How many of you had head injuries when you were children? I should maybe get in these wings, go forward and then fail, boom. No pasó nada, me levanté otra vez. Chicotas, pero me levanté. So it doesn't matter, like all these injuries, head injury can be instant when you start having issues with your memory, or it could be something that is far more delayed and it delays the onset of the disease, right? So we have to be very mindful about those things happening. So that being said, let's play a little bit of loteria. Alright? Healthy habits. Learning more about healthy habits and healthy brain and healthy brain energy through loteria. You ready? No, there's no prizes. I just want you to have some information on this. Alright. Tome se va. Take a class. Tomar una clase. Aprender algo nuevo. I don't even have like the little beans. Oh, I'm sorry. There will be prizes, so Caterina, I don't even have little beans to. Oh, what do I know? I don't play bingo. I got thrown out of bingo with my friends. All right, take a class. Tomar una clase. I'm sorry? No, I'm sorry. I was just repeating. Okay, next one.
It was take.
Take a class. Take a class. And it looks like this. Formula heads with a monitor.
Take a class.
Take a class. It looks like this. Formula pen with a monitor. Yes. You're my guinea pigs for this game, okay? Next one. 10 healthy habits for your brain. 10 hábitos saludables de su cerebro. It's this, the little checklist and the little apple.
A tablet with an apple.
Tablet with an apple.
Who's the first one?
The price is right now.
Eat right. The place with the organs and eyes.
Take a class.
Eat right.
It's a table setting.
The table setting. Eat right. It's a plate and utensils.
Es un plato y la cuchara y el cesto.
Genes and family history. Brain healthy habits can make a difference even for people with family history of dementia. By itself, we know that gene takes a place in diagnosing somebody with dementia in less than 4% of the cases.
What we call the family tree.
The family tree.
The next one's the family tree.
The family tree.
The table setting. Claro. El árbol familiar. Que toma parte, si hay incidencia de demencia e historial familiar, que también la incidencia es menos del 4%. Okay. Get your blood sugar levels checked. Checar su nivel de diabetes, su azúcar. Talk, mommy. Get your blood sugar checked. Talk to the healthcare provider and get screened, preventing or controlling diabetes, benefits brain health. Your sugar. Checar su diabetes, revisar sus números, que estemos todos normales.
There we go. Yes, yes.
Oh, you can slower. Got it. I'm gonna timer you off. wait for the next card. Okay, ready? 1 in 3 adults will develop Alzheimer's. 1 in 3 older adults. 3 little bodies in a circle. And it says, 1 in 3 older adults dies with Alzheimer's or other dementia. 1 de 3 personas con Alzheimer's fallece a consecuencia de Alzheimer's. 1 in 3 adults. ¿Mande? Yeah, older adults. Okay. 1 in 3.
Be specific, dice.
I'm sorry.
It's okay.
But bearing in mind that the reason why someone dies of complications of Alzheimer's, like Dr. Castillo explained, it starts to shut down the body. Like memory goes first, and your ability to eat, your heart gets also affected, and kidneys get affected, and so on. Ready? Maybe I'm not the good person to do it.
This is the 1 in 3.
Build movement into your day. Build movement into your day. Meaning, there are lots of ways to get exercise. Find what you enjoy, whether it's walking, dancing, working in your garden, whatever that looks like for you.
Do you have
The
the
walking analogy is like this.
It's a running man.
running man?
1 minute.
Ooh, that's a good movie, by the way. It doesn't cost me, the running man.
Un hombrecito como que está corriendo, ¿eh?
How are we doing? Alright,
All 4 have to be.
ready? Be smoke free. Dejar de fumar. It's never too late to stop smoking. Quitting can lower the risk of cognitive decline back to levels similar to those who have not smoked. Quit smoking. A little cigarette and then a little bit of frosting.
No fumar.
Little cigarettes. No cigarettes.
No cigarettes.
No fumar.
So, Cheyenne, are we doing the 4, the cross, what are we doing? I think we're gonna do the 3 now, and then we'll do that. Okay,
No, it's the 4, traditional 4.
okay,
Up and down.
okay. So you need to tell me that no one has gone bingo either? Wow. Yes. Es que es nuevo y pendiente eso. All right, so when you need help, who do you call? The Alzheimer's Association.
Así veo yo.
For free, you can call our helpline is 24/7. It is available over 200 languages. We don't want language to be a barrier as to why you call. Alzheimer's Association.
A ver, ¿qué dijo
¿Qué
Alzheimer?
tiene que
Acá.
¿Van aquí? ¿No van aquí?
Sí.
¿Sí? Ah, bueno.
Bingo.
Juan Bingo.
Bingo with Alzheimer's Association hotline.
Yay!
Hizo bingo con la línea de 1-800.
Nice to meet you.
Do we clear the card?
Hacemos otro más. Sí. Sí, timekeeper, how many more minutes?
I think they're
10
gonna.
minutes.
Yes, opening our. Yes.
6 minutes. We can do 1 minute.
It's 12:30.
15 minutes. No quiten sus números porque vamos a seguirle. Corre se va. Corre se va. Let's keep playing the same part, don't move your eyes. Ready? You don't have to be moving. I mean, we can just keep going.
Don't clear the card, keep going.
All right, ready? Va a seguir, we're gonna keep going. Va a seguir la casa. Challenge your mind. Make your brain work hard and learn something new. Get out of your comfort zone and try a new hobby or learn a new skill. Challenge your mind. It's the little brain with the little tortitas, like the little spin wheels.
Es el cerebro con un mecanismo. It's the brains like with the mechanism. It's this brain with the mechanism.
Ready? ALC.org, brain health. ALC.org, brain health.
Bingo.
No, let's keep it.
Don't take them off. Visit our page, the ALC.org brain health. Learn how building great, healthy habits can help you live better now and protect your memory and thinking for the future.
Oh, she did? Okay, bingo.
Bingo! Yay! We keep going. We have time for two more short games.
It's como like a little computer with a brain, eh? A little computer with a
Don't move
brain.
it. Just keep going. Monday.
Going on the same part. You're playing. You
Yes,
continue
go.
the play.
Ready? Ready? Get moving. A well-rounded exercise between includes aerobic exercise that gets your heart pumping faster, the strength training and flexibility exercises. The little tennis shoe or the sneaker.
Sí, es eso.
Acá hay otra persona conmigo. Bingo, bigger too.
I got it. Wait, hold on. Yep.
We're gonna do one more and wrap it up. And then give me, like I said, I'm a more bingo person, but it's okay. I don't do bingo, so.
Vanessa?
Note to self, the next bingo we will have the cards.
Where was the other bingo? Raise your hand.
All right, over there, maybe in the black shirt.
Ah, I got it.
All right. Ready? No, un juego más. No, sigan jugando. Sí.
Vanessa? Coming.
All right. How many of you already have an engaging way of getting exercise? Are you already doing walking? Exercise? Dancing, yes. Okay, here we go. The brain weighs only about 3 pounds, yet it's the most powerful organ. The brain.
A ver, cerebro.
Ahí voy.
Cerebro.
¿Ganó con esa?
Go.
Mira, gracias. Aquí está.
El cerebro. Yep. Bingo again.
The brain. Alright, ready? Talk with the doctor. Get your blood pressure and blood sugar levels checked. Make a plan to build and maintain brain healthy habits. If you have any concerns about your memory, tell your doctor. Remember, memory is the first thing that we start to notice when it comes to dementia, but that is not the only thing that we need to be aware of. Are our loved ones falling more often, for example? Are they afraid to walk because maybe their vision is getting distorted? Talk with the doctor. You want to go to the doctor, get the proper diagnosis, because current infusion interventions only work when you're truly in the early stages of the disease. Es importante el doctor que tiene el diagnóstico apropiado, porque los tratamientos que existen hoy solamente funcionan si está realmente en los inicios de la enfermedad. Talk about the infusions, like you can get infusions, the Cambi, Insula. And if you want to get tested, talk to the UTRGV, aging and memory.
Bingo over here.
On it.
Aquí donde está.
And get tested. Get the imaging, get properly tested. Okay? Carnegie? Near the VA, you got this? Yes. Are we good? Yeah. And I'm gonna do the last part. That's it.
Did you say prevent falls?
Prevent falls. No,
Oh, no?
no.
Okay.
No, I'm talking about the warning signs, that it does start with memory, but it's also about losing balance, falling more often, not being able to see things, not being able to build your muscles and so on. Okay, the last part of the evening, last part of the day.
We have a winner.
Add more healthy foods to what you eat. Make small changes to recipes that are important to you. For example, try switching to a cooking oil that is lower in saturated fat to make a favorite dish healthier. There's many alternatives to regular vegetable oil, for example, olive, avocado,
A picture of the apple.
la manzanita, es la manzanita. And the last one, go dancing. Exercise increases blood and oxygen flow to the brain and improves connections among brain cells. Make it fun. Having a new diet or following nutrition guidelines or having to incorporate a form of exercise. It really does. We don't have to get ready for a marathon, but if you want to, by all means, do it. Yes. So I appreciate your patience. This is my first time doing the bingo. I'm learning with you guys, but I thought this would be a fun way that our families and providers in the community can really utilize loterias, something that we already do, to learn more about Alzheimer's disease, healthy habits, aging healthy, and so forth. Any questions before we wrap up my session? Any questions? Preguntas? ¿Todo bien? Thank you for playing along. I appreciate it. I appreciate that.
I have placed them on the table.
All right, well, congratulations to all of our winners. Miss Vanessa.
The little tablets go to the chair. Yeah, you can share.
We're just gonna go ahead and well, let's see how many winners we have, okay? If you can, we have some stickers on certain underneath your chairs as winners. Okay, so if you have a sticker underneath your chair, go ahead and let us know. And you'll get one of our other winners.
Has to be your chair, not neighbor's chair. We're not
Has to be your chair. You are the third one. Let me know if you want to see. Oh, I think we found a ticket. Over here in the back, that's it. Okay, from one, anybody else? One winner. Oh, I have another one. Yes, we have another ticket.
We've got a sticker.
Beautiful. Over here.
Hold it up. Little white.
All right, thank you all so much for participating in both the Alzheimer's Association activity and Red Chair activity. Y'all did wonderful. Thank you very much for the wonderful information that you provided for us in regards to quality for your practice. Definitely something that we can take back with us as we continue to learn more within our own homes, with our family members, friends, at the facilities that we love to engage in, right? So it's important to think about how we can continue maintaining our family health, right? Especially the preventive questions today. All right, everybody. So before you leave, we are going to ask, in case anybody does have some kind of activity, we do have some surveys that we'll go ahead and pass out to the tables, please. Miss Anna, may you get those for us and continue that, please? Thank you very much. For the rest of us, we have a very exciting panel session. I know there may be some additional questions that y'all may have. I know that there may be maybe some insight that you can look further into. We will be introducing our panelists shortly, so let's go ahead and take a quick 5-minute break. Okay, 5 minutes. So at 12:53, we're gonna go ahead and go through, okay? 5-minute break, we're gonna go ahead and do our panel session.
Health, and I'll be speaking as your moderator today for today's guest panel of speakers. We are honored to host a very special group of providers and community professionals whose unique lived experiences can help us all learn something about dementia today. Our panel today consists of 4 remarkable speakers who all work to serve people living with dementia in this special way. Some of you may be caregivers for someone living with dementia. Maybe you work. This afternoon, we hope you know that you're not alone. This afternoon, we have Miss Lisa Lefebvre and Maxine Garrett, who both serve as caregivers for their loved ones. To my left, Miss Lisa cared for her mother-in-law, and Miss Maxine also cared for her mother. Additionally, we're also joined by Officer Atlanta Rodriguez with the Harlingen Police Department. Through his work at the Harlingen PD's Mental Health Unit, Officer Rodriguez has first-hand experience working with community members in crisis, including people with dementia. Last but not least, we have Dr. Gladys Mayer. Dr. Mayer is the director of the UTR's Alternative Resource Center for Minority Aging. As a physician and a scientist, Dr. Mayer works every day with families living with dementia. Today's panel has generously offered to donate their time to answer pressing questions that our community has asked. So on behalf of all of our guests, please allow me to thank you all very much for answering these questions. So, I have this question here.
No.
I'm so sorry. Without further ado, I'd like to begin with our caregivers. We like to believe it's easy. So, if I may, one of the questions that we had is, how did your role as a caregiver change over the course of the disease?
So, it was my mother-in-law who had dementia.
These mics,
Hello?
Go back.
Is that better? Okay. So it was my mother-in-law who had, who was diagnosed with dementia. And, after, a couple of years, she came in, lived with us, she moved in with us. So my role as a caregiver was to make sure she could do her daily tasks. After a while, my mother-in-law did not want to shower. So that was one big role that I played in making sure that her hygiene, she was keeping up with her daily hygiene. And that was tough because in her mind, she had already taken a shower. And so I had to learn how to be more patient. I had to learn how to talk to her. That was the biggest obstacle for me because she was my mother-in-law. I was taught to respect, and here I had to be a little bit more forceful with her and telling her, soy no se bañó, necesita bañarse. And I would have to guide her to the shower, turn it on, and help her start to undress. So that was huge for me. That was very, I guess, humbling as well.
So it sounds like that when you first had her in, it was in the earlier stages, and she had a more formal stage. She knew that as it moved down, her assessment of yours.
Yes, because she did live with us for about 5 years.
Okay.
So we saw the transition from the time she first moved in to the time she passed.
5 years old. Maxine, has your experience been similar?
So yes, I mean, we saw the decline in my mother even long before she had the official diagnosis, and then as the disease progressed, as I started working with this organization and seeing my mom's behaviors, I understood that something was happening that we were not paying attention to, right? So even getting her diagnosed for a while, and so once we knew what we were dealing with, I mean, my mother held on to some semblance of cognitive awareness for a very long while, but it was when my dad passed away that she couldn't let it go. And that's when we started to see the behaviors that she was reluctant to take a bath, she didn't want to eat, her usual stuff. And let me tell you that having an access to resources, because I work with this organization, it's not didn't make the journey of transition any easier because I was still dealing with something that was very new. My sister, on the other hand, had a harder time dealing with that because she and my mom, like, you know how you say in Spanish, you know, right? Because they were together all the time. I was a long distance caregiver, but I was here every weekend to take care or provide support systems to my sister and my mother. And it was just, to your point, humbling to see a very strong-minded individual, very formidable woman now being so dependent on us. Like, we had to literally walk her through every process, and I learned patience, which I had done. I learned that many times it wasn't my mother that I was dealing with, and I also learned that whatever happened in her life, it was also an amplification of that trauma or challenges that she might have faced as she was growing up. And it's made me a better person in a lot of ways. But to this day, if I see a video about the disease or it's still very much difficult to transition to those conversations. And yeah, in your life, your whole life changes as a caregiver. As a daughter, because I was no longer the daughter, I was just the caretaker. And even when my mom passed away in her last days, she was not asking for me. She was asking for my sister because she and my sister had lived longer together before I came to the picture. But somehow she still had a sense of recognition. She just didn't know how to put it together.
Sure.
Yeah.
So it sounds like the mention for you was very.
Okay.
Thank you.
Oh, yeah.
It sounds like the mention for you, for both of you, was very transformative. It not only transformed for them over the course of the condition of things, but it also changed your life at home. It changed your sense of identity. So as from daughter, caregivers, right? From in-laws, and I swear that to you now, I have to be forceful to you. I have to change my goal, my identity with you. How I feel towards you, we change, and lastly, ultimately, learning to grow as a person, a patient in your problem. That's excellent. Phenomenal. It's very good.
In hindsight, 2020, I can tell you when I put on my professional hat, is that learning how our loved ones were raised and how they grew up, it is very helpful when you're a caregiver because then you can understand the behaviors a lot better.
So if I may segue a little bit, you mentioned resources, and I was very impressed by what you said. You mentioned that even though you work for the Alzheimer Association, and you have all this access to this tremendous resources, on its own, I will work it out. And I wanted to ask, so what resources or support systems make the biggest difference in caring for yourself or caring for your family?
I'm not an example of how to take care of yourself. Because I failed miserably in caring for myself as a caregiver because I was a long distance caregiver with a lot of guilt that my sister was the one caring 24/7 for my mom. But in learning really how to navigate through the behaviors, understanding what she was going through, and also the support groups, you know, doing presentations and being around other caregivers, that's what I learned. This is why I always recommend to anybody caring for somebody with dementia, you have to go to a clinical environment, just go and listen to other caregivers, you learn from them, you know, they're the ones walking the walk, they're the ones that already did it, are about to do it, they've experienced it, and they can give you the best advice there is in caring for your loved ones. But I had the clinical piece and the resources available to me. But if you're not ready to accept that help, because you yourself are still trying to figure out how to provide that care, I mean, it's when you start to put it together. You learn from your peers before you learn from the clinical.
So it's not like even distance caregiver, the visit is still very isolating, very difficult.
Absolutely, you know, there's a lot of cancer plans, there's a lot of guilt because you're not there, there's a lot of resentment because you don't have a life or a long-term, and that's just the reality. I often call it a reluctant caregiver because nobody's asking you if you want to take care of your mom, if you want to take care of your dad or sibling. It just sort of falls in your lap, and you just have to do the best you can
to let you know in that moment.
Absolutely. Ms. Montalvo, may I go?
Yes,
Please. So you mentioned that your mother-in-law lived in a home with you.
yes.
Was your experience different? What resources or support that helped you in like your access?
So I consider myself a part of the sandwich, I guess, category or group, because not only were we, my husband and I were taking care of my mother-in-law, we also still had children at home. And my youngest was 10. So she was still active. As my oldest, she was still in high school as well. So they were playing sports and we were traveling to things and so forth. So it was very difficult when my mother-in-law would get into her mood and she'd say, no, I want to stay here. I don't know, it's too hot, it's too cold. But we couldn't trust her to stay home because she'd want to cook and then she'd leave the stove on, or she'd want to go for her walks. And one time she did get lost and the PD came looking for us, and we noticed this woman. And so we said she has to come with us. So that was hard. We went to her primary care physician and he said, oh, she's in her 80s, just let her live her life, let her be, let her do whatever she wants. But that was hard for us because we still had children at home. And so the resources, we weren't provided with any. So it wasn't until I was invited to a Alzheimer's and dementia session hosted by the Healthy Brain and Aging program where I learned about some of the resources. But we live in Australia, so there's nobody local there. And we did learn we learned how to talk to my mother-in-law. So when we did have to travel, for example, when we had to travel to Kansas to drop my son off at college, she would not sleep on the road and she kept asking, are we going home? This isn't the way home. When are we going to go home? And so I was like, okay, we're gonna go drop off Ethan, then we're gonna head home. And so just learning how to talk to her was the most difficult. But in regards to resources, once again, the primary care physician was not available to us. It was just this one session that we attended, but then it was hard for me to get away to attend any other session. So it's, yeah.
I think you really good at time is a resource, and when you are a caregiver, that is very, very limited with, especially when you're raising families.
Yes.
And in particular, it's very hard to hear, and I'm sorry that it's happened to you, where your clinician will say, oh, well, let them be as they are, unless that's an experience their life, but they're not necessarily taking into account that that kind of experience.
Right.
I have to raise my family, I have to make sure they're safe. It's much easier said than done.
And I'm sorry, only because he did suggest a nursing home. If it ever got too much, just, place her in a nursing home. But my mother-in-law had already stated, I do not want to go to a nursing home.
And that's out of respect. You want to respect the wishes.
Yes.
And ultimately, with resources, thank you very much, I appreciate that. I wanted to segue briefly. Ultimately, when resources kind of fall apart and you don't have the support, you're forced to rely on emergency systems, the safety net things in the community. You mentioned that a police officer came in, that's one of the reasons why we have opportunities here today to speak with us. So, if I may, we have some questions that came from the community. You mentioned that you wandered, and that's actually really got a question there. I wanted to ask you, so what do typical calls regarding individuals with Alzheimer's disease or related dementia involve? For example, wandering, aggression, what does that look like?
So most of the calls that we get from the police department in regards to a wandering individual who has dementia is death. That's the number one call we get. At that point, the call becomes a priority call. It becomes a rescue mission. Majority of the time, we try to dictate how long it is. Usually they'll tell us between 30 minutes to an hour. And we all know people with dementia, they lose their awareness of where they're at. So we're trying to prevent them from going into busy traffic, into a wooded area where they can get disoriented. And at that point, they get lost. We all know here in South Texas it gets very hot. And the last thing we want for them is have a heat stroke, they pass out in the field, and we're able to locate them.
Sure.
So when a call like this comes out, at that point, what we do, we have every officer that's available, not on a call, responds to the general area. We set up the perimeter, we try to say the description of the subjects, their height, weight, the last thing they're wearing. At that point, officers will start searching the area for the individual. Once we locate them, we'll return back to the family, depending on their condition, if not, we'll get EMS involved.
Absolutely, thank you. So from what I'm hearing, it sounds like time is of the essence. As soon as you find out of the officer, you can respond. But family to contact y'all first to let you know, hey, someone's missing.
Correct. And I always advise people, there's no such thing as a 24-hour. Of course. Once it's been 5 minutes, you can locate them, call us immediately.
That's good. So there's a misconception that you need to wait 24 hours to consider someone missing. And you're saying that they can call if it's been 5 to 10 minutes.
Correct.
Understood. Excellent. Thank you. That's very important to know.
This is actual research. The theory is that a person that wanders is going to wander through the dominant hand. So if they're right-handed, start search to the right. If they're left-handed, start search to the left. If that is unknown, they automatically go to the right. And I think it's because it's the thought process that they're not able to start thinking, I'm gonna go to the bar that I used to go out to, when I was 25. It's really just like, they just follow what is already in naturally. So yes.
I appreciate it. Thank you. And then that leads to our next question. So, given that time is so important, and given that there's the critical process in providing care, what can families do to better prepare for emergency situations involving a loved one's dementia?
What I tell a lot of the families is make an emergency file pack.
Okay.
The emergency file package should have a recent photo of the individual within the past 6 months.
Okay.
Something that shows their features, nothing covering with sunglasses or hats. At that point, it should have a doctor's note. Okay. Showing that they're diagnosed with either Alzheimer's, dementia, that they're over the age of 65. Should have the doctor's information, contact information, and another thing that should get to that list is, I'll come back right now to the physician's note. It should also include a one-page paper basically regarding what they fear the most, what's their triggers, are they scared of loud noise, sirens? So also another thing that should be on there is, what do they like? What conversations are comforting to them? So once officer makes contact with them, we want to frighten them, we want to let them know that we're there to help them, and we're not there to arrest them.
Sure.
Well, another good thing to have on that list is also have your vehicle's information on that paper, the license plates, the VIN numbers. And this goes back to the doctor's note. Worst case scenario, we're unable to locate them. And it's happened in the past where the individual will get into a vehicle and leave the location. And we know they have dementia. So we're trying to figure out where they grew up, what's their location and neighborhoods that they're from. At that point, we're unable to locate them, there's certain criteria that must be met in order to put out the silver alert through GPS. So it has to be one doctor's note, which shows their diagnosis of either Alzheimer's or dementia over the age of 65, and if they're a risk of death. Once you get that information, you automatically send it to GPS, and they make the final determination whether or not to send a silver alert.
Understood. Okay, thank you. So as a first responder, again, your time is of the essence. To make sure you can get services where they need to go and to get that silver alert ready, you recommend that families prepare a packet.
Correct.
And this packet should have essential characteristics about the person. So their diagnosis, right?
Yes.
Their medical information in case EMS needs to respond, but that trigger is relevant. Their likes and dislikes, their triggers, what they're afraid of. And was there a fourth? I forget.
The fears?
Fears, of course, the triggers. So preparing the patient, having that available is important, especially if you know that you already have a loved one living with dementia. Now, you mentioned if they have a diagnosis, to put it in there. Would you recommend that families who don't have a diagnosis still prepare this for?
Correct.
Okay, excellent. So you do not need a dementia diagnosis to be better prepared. I appreciate that, officer. Thank you very much. You mentioned medical records.
Correct.
I want to transition to Dr. Manson. Not Dr. Manson. You are a clinician and a scientist. That's a very unique combination. And I wanted to ask, in your experience, because we're talking about fears, what are some common fears that people have about receiving a dementia diagnosis?
Well, first of all, thank you for the invitation. I really feel so proud of this team that has organized this event. And it's not only one event, it's a whole program that has sensitized and brought together the community, including, of course, Alzheimer's Association, first responders, and everyone. Thank you so much. So, how do you get the diagnosis of Alzheimer's? You know, before it used to be when the person has been searching for years for a diagnosis. You know, the family member. So in the past, it was no surprise. You know, I wanted to know what my mother had, and now I know it's Alzheimer's. That was in the past. Why? Because we didn't have a test. A real, useful, accessible blood test. We needed to see the brain through different imaging processes. We needed a lot of testing, and we needed time because we needed to see if the person perhaps was grieving, depressed, or there was any other explanation for the cognitive changes. But now, you can have the diagnosis with a blood test. You don't need the memory problems. Yeah, you are listening right. You don't need to have any memory problem to get a diagnosis. So right now we are having an influx of people that they want to know if they're going to have Alzheimer's. They want to know, but then when they come to look for the results, they are so scared. Some are scared of becoming a burden. Some are scared and embarrassed to bring another tough issue to the family. And of course, everybody is afraid of having to become dependent. You know, to have somebody cleaning your butt, to having to eat everything liquefied, and to being put in a nursing home. So now we are learning, because this test has been available only for 2 years, and now if you say most insurance cover it, but there is the option that if you don't want your insurer to know, you can pay for it and have the test. So we are learning. Some people say, I do not want to know. What do you think? Just roughly. Would you want to know if you're going to have Alzheimer's in the next 10 years? Yes. You want to know? And those who do not want to know, you know, I guess that all the other ones. It's scary. It's scary. So you need to look for the diagnosis when you are ready. This is an example. Like if you suspect that your spouse is having an affair, ask when you are ready to receive the question, the answer. Yes. So it's the same for Alzheimer's. You want to know? We can tell you. We cannot tell you exactly when. I cannot tell you by March next year. No. But we probably we can tell. Like we can tell with prostate antigen, right? We can tell with so many tests now, right? So be ready, understand yourself, why you want to know. Some people ask me like, okay, doctor, what do you think? Should I save the money for my future healthcare, or should I just use it and enjoy the life? And so everybody has their own way of taking diagnosis. I would say for me, spirituality is very important. Being in peace, what's your mission in life? what is it that you can contribute to the world at any age. And there is always way to delay the process. So if you have a risk, high risk, if the tests are positive, then you cannot wait. You really need to implement those loteria tickets in your life. So but still it's hard. And I mean, we all know like what is getting involved where we are afraid of getting a diagnosis or a prostate scan or X-ray from the chest and smokers. It's scary. But if we know, we can do something about it.
I admire that. Thank you very much, Dr. Masters. So,
I have a question.
we'll give in just a second if you can speak to Lisa, and then we'll get right back to it. Right.
I just want to add, because of my mother-in-law's diagnosis of dementia, my husband joined a study to see if he will have dementia. And he had the MRI done, and he is afraid to get the results. So he has not gone back to get his results. But as a caregiver, I would like to know so I can plan and prepare. And he doesn't understand that. And, as well as for my children, so they can prepare and as well plan. And I think now is the time where we can actually have those conversations. But he's afraid to get and this is his journey, so I can't force him because this is his decisions. I can just support him. So
Fear is both an incredible driver and an incredible carrier. I think it's important to keep that in mind and know that when you're ready, there's things you can do to help yourself. Now, you mentioned you had a question.
Yes, I have a question. Is this test available right now?
Yeah, it is available.
Do we need a doctor's?
So if you want the test to be covered by insurance,
Yes.
you need to have the doctor, and what you need to tell the doctor, is that your memory has changed and that perhaps you have some concerns and some risk factors like diabetes, hypertension, trauma, family history, all this. So, almost anybody.
Do you find, doctor, that other doctors are referring for this test?
No. Because it is very hard to keep back the results. Because what do you do? So you have the cholesterol, and then you say, well, we're gonna refer you to, you have to do this exercise, take this pill, and so forth. When you have like mammogram with, cancer, you say, well, we're gonna refer you to the oncologist, and everything happens very fast. But finding a referral for a neurologist in the valley, it's hard. Because it takes like 6 to 8 months. So the primary care physician is like, do I really want to do this? I'm just gonna wait until she gets worse, and then we refer that to the neurologist, and then we wait, So that's why FDA approved over-the-counter tests. So
Over-the-counter test?
yes,
what are they? Where can we buy them?
No, I know, I did it myself. So basically there are, like all labs have their own price. And there are, because of the explanation it's hard, there are some companies now that offer the test online, and you go to a place, they take the blood, and then when the results come, they actually have a nurse talking to you, explaining. In this way, depending on, the kind of services, the price of the test begins at $42. So it's not as bad, right? It's not bad. And like, I am not a speak person for laboratories, but for example, what I did for myself, you know, I paid $360 for 160 tests. They took my blood in Westlaco. I received it on my phone, the results, and then, you know, they gave me advice. So I thought it was a good deal. I don't have to tell my insurer. I don't have to disclose to my coworkers. I don't even have to tell my husband. The results. So there are options. So each case is different. The motivation to have a result is different. Particularly if it's the genetic test.
So is it over the counter?
It is over the counter. You can buy it. You know, Alzheimer's test, you can buy it. And they send you, you know, the number, and you go to, like I have my blood drawn in Westlaco, inside Walmart in Westlaco. There is a lab quest there. They took my blood, and I got the results over the phone. I mean, you know, in an hour and a half. So you have more power, but you need to be ready.
It was the same question that was asked.
To do this. And going through the experience made me think a lot about, you know, the way you really want to tell my husband this, you know, or my coworkers or my kids. So it's a very interesting experience.
And if I may add to the conversation, right now there is a legislation being pushed forward. It's a bipartisan effort. We need to call you legislators to really pass it and approve it, because the goal of that legislation is to change the wording, how Medicare approves of a test, so that it can now become part of your regular screenings, like how you get screened for diabetes, how you get screened for cholesterol, how you get screened for cancer. Yes, there are certain things that they have to, protocols they have to follow, but if they change the wording and the legal wording in how they approve for those tests, then it becomes accessible to everybody. And you can learn, because as we know, we learn about Alzheimer's disease at least 10 years, 5 to 10 years before the actual diagnosis. So the sooner we know about it, the better prepared we are to make plans to that.
To follow up, I wanted to mention, you mentioned your fairly new tests that came out in the last 2 years ago.
Yeah.
Because they're so new, it can be hard to pinpoint which tests are out there and where exactly to get. So if you'd like, please feel free to reach out to Cameron County Public Health's Health Rate Aging Program. We have our flyers and dementia resource specialists who can help connect you to the Research Institute and other local organizations that are able to facilitate this testing for you. So please don't hesitate to reach out, get a flyer, and let us know what you might have issues with or what you might be interested in.
And just one test, the minimum, the most sensitive is called p-tau 217.
What? Give it again.
It's P like Peter, tau, T-A-U, 217. 217. So this is the test that we believe should be the minimum for everybody. But we need to prepare the workforce. You know, we don't want, you know, like somebody that's saying, oh, I'm gonna have Alzheimer's, or, you know, we really need to prepare the workforce and what to do with the results of the test. And I'll give you one hint that I learned, you know, I listened to Maxine meeting. Do you realize that Texas has a law that we pay for 6 hours of college tuition for individuals that are 65 and older? You want to go back to college? You know, 6 hours per year. I think that's a great deal. Because you can do art, you can do dance, you can do history, you can do, nursing, you can do, one class. It's usually 3 hours. And Texas, we pay for 6 hours. And one of the things that we are trying to improve is to have 10 hours. Because we want older adults being graduates from college. We want to bring older adults to the university. Our kids need that, really. And we, as older adults, we benefit.
Great help is doing getting together is extremely important. So before we bring the panel to a close, I want us to field 1 or 2 more questions from the crowd, if you have any, to our panel of experts here. Begin.
What is your name, ma'am?
Gladys Maestre.
Your phone number, please?
Yeah, you can have it right down. It's 732, that's my zip code because I went to school in New York. 732-372-3378.
Thank you.
The only limitation is text me.
Okay,
Because I'm very bad at talking.
And also losing the fear to participate in research. We have great research happening more so than ever because we want to get people already diagnosed early enough in the disease process. Because the current medication only works if you catch it early enough. Otherwise, you're not a candidate to take advantage of it. Especially the infusion.
That's an excellent point. Before we go, is there any way that the audience can connect with you and your center to?
Well, you now have my phone number. You will have this email, memory, 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 at utrgb.edu. utrgb, which is University of Texas, Rio Grande .edu. And every month we enlist about 30 to 40 people, new people, in this registry. So when opportunities come for age, gender, language, and things, we call them and invite them for free, and usually these opportunities are paid. Sometimes they are paid just to give us an opinion, participating in focus groups, for example. And now we are going to launch a US pointer here in Bali, and we're adapting, so we need the participation in people with organization of the study, for example. And then we want to involve people that want to prevent Alzheimer's.
Understood. So that's memory at utrg.edu. That's utrg.edu. If you're interested in working with the university or hearing more about what they have available for you, generally at no cost to you, please do send a message to memory, MEMORY at utrg.edu. Now, I believe that's all the time we have for today, but I wanted to once again thank our fabulous panel of guests for their time today. Thank you all very much.
Thank you.
All right, everybody, unfortunately, the time has come where we are now ending our time together, but it has been wonderful time, well spent with each and every single one of you, and we hope, whether you're taking back what's going on in the community around brain health and dementia action, what's going on to progress caregiving resources, how can we work on improving our engagement and how that's beneficial for our health, or even the thought process about therapy, right? Participating in speech, physical therapy, occupational therapy, and how that continues to be a benefit even after we do a simple diagnosis. So whether you've learned, a little bit or a lot, we hope that you've taken at least something with you, and please share that with the community, with your family, friends, loved ones, and we look forward to having you all again back next year. Have a wonderful rest of your day, and thank you all so much. Apologies. I know we had some notes on the table around the flowers, but because we had enough raffle prizes, If anyone would like to take the services with them home, you're more than welcome to take the flowers from. Please, we are going to take the flowers with you.